And I argue that I'd love to get your insight on this because I put it very simply. This is just what I observe, is that the majority of the things that cause negative symptoms on TRT, like the side effects on TRT, they are caused by the unresolved issue that caused the low testosterone in the first place. So if you're drinking tons of booze and you're fat and you give yourself the testosterone levels of 21-year-old Giga Chad, you're going to get side effects. Like it's got to happen because you've just put a Lamborghini engine into a piece of shit Suzuki Swift that needed a service. You didn't service the rest of the car. You just put a sports car engine in it. And then you drove out of the parking lot and you sped out of it and then it all fell apart and you went, oh, this engine's shit. It's like, no, it's not. And that's what I have found is the majority. What we need to look at is going, if you want to put the optimal amount of testosterone into your body that you could physiologically make, and you want that upper limit of TRT, the sports TRT, the testosterone optimization, whatever the fuck you want to call it, you have to live in a way that if you could, you would be making that level naturally. And that will solve the side effects, assuming that your protocol is, at least a couple of times a week injections and you're not doing big peaks and troughs and stuff. That solves the majority of issues, but guys don't want to do that. They don't want to train well. They don't want to eat well. They don't want to sleep well. They don't want to do that. They want a shortcut.
No, and that's one of the most problematic things that I run into for the past decade is that the expectation of, for instance, I'm going to take fucking Anavar and Deca and this and that, and I'm not going to do shit. I'm going to eat like shit. I'm going to be lazy, and it's just going to do all the work for me. And it's very similar to this. It's like if you have a heart condition or a cholesterol condition and you start taking a statin, for example. Well, if you're still eating like shit and you're lazy and you're sedentary, what do you think the statin's going to do for you? Aside from give you side effects, which it's going to do regardless. Do you really honestly think that it's going to start like hardening plaque or clearing plaque out of your arteries when you're just feeding the fire? It maybe will mitigate it. It's like working your ass off just so you can eat like shit. You're not going to get anywhere. You're still going to go backwards and you're still going to hurt yourself internally. So if you're taking TRT with the expectation that, oh, I'm going to take TRT and I'm going to feel great and this and that, but I'm going to still eat like shit. I'm going to, like you said, I'm going to drink. I'm going to party. I'm going to be lazy. I'm going to smoke, whatever the case may be. Don't expect it to help you and expect to have a slew of still side effects and get nowhere fast. And it drives me crazy because everybody wants. And look, I'm a realist. We all want things right now, but the differentiating factor there is you and me may want something right now, but we still realize we got to do the work to get what we want and willing to do that and make the sacrifices. If you want to go get help, get TRT, great. That's a good first step. But if you don't want to do everything else that goes along with it, it's not just take this and get fixed. It's take this, make the lifestyle changes, change your quality of life, you'll get fixed. And that's, it's hard to embed that into people's head when everybody wants to just wake up and be fucking Mr. Olympia. It's just not how it works. The guys that are in Mr. Olympia, yes, we are all aware they have to take X amount of whatever, but they're still busting their ass. They're living the lifestyle and they're doing it like 7 days a week. I do that. I'm not on a bunch of shit, but I live it 7 days a week. I don't cheat. I mean, literally before I got on here with you, I had already done 2.5 hours of cardio and lifted for an hour. And that's how I start my Friday. Most people on Friday, it's like day off, or, oh, we can take it easy today. So I'm with you. And a lot of the people, they have these expectations and they don't live in reality. And I can't stand that. It drives me absolutely insane. And I'm sure you run into that quite often with people that come to you.